I would like to express my deep appreciation to our team. I'm very proud that you decided to step up and further your commitment to keeping all of Sun Prairie safe by purposely delivering very compassionate and professional and helpful services to those facing a mental illness. I'd also like to extend my gratitude to Captain Roman and the Madison Police Department for their leadership in this area and for all your guidance in helping us come out alive. Thank you very much. And I'd also like to thank our partners throughout Dane County that work hard every day, take a strong interest in this area on this important topic, during mental health, NAMI, and Dane County Human Services. So thank you to all for your attention and commitment to this important new adventure for the Sun Prairie Police Department. And thank you for celebrating with us.
Thank you. So, the way I became involved is Chief Anhalt came to me and wanted to know if I would be willing to sit in on or represent Sun Prairie more accurately, on a group of departments in Dane County that were eventually trying to form our own mental health teams. So I joined into that group, which consists of Sun Prairie Police Department, Middleton, Fitchburg, Monona, and Verona. And we as leaders came together from our departments and we started looking at how can we develop a team within our own agencies and how can we make those look, and we shared ideas and met as a group, and Sarah usually was part of our group and Kristen Roman was part of our group to help us all figure out how to make our teams look and how to get them off the ground. So that was sort of how I got involved in this, and then Michelle Wilson was attending those with me, and we sort of sat down and wrote a proposal of what the team's objectives would be, how we wanted our team to look, how we think this would impact our community and our city and our department, as far as dealing with mental health consumers that live within our community and to best serve them. So that's kind of how I fit into this role. And then my goal was obviously to supervise our team and give us direction as we move forward as a team to hopefully interact with the people that are living in our communities.
I think my role kind of started a few years ago because I've been on patrol for going on 15 years and been with the city almost 19, dispatched records different ways, and as I've grown with Sun Prairie Police Department, I've seen the calls for service that have that mental health component, whether it's autism, dementia, suicide calls, substance abuse, or a whole plethora of different kind of mental health issues go up, and the law enforcement has been kind of triaging in the field, but we weren't getting a lot of training. And so I started reaching out for different training, like mental health first aid. I think Brenda and I went to an autism class and some elder disability and aging class, and then finally found the CIT training that the Madison Police Department provided, which just like struck a chord. It's like, we need to do this, and just having that experience in our community. And so when I saw that and then went to our leaders and said that we need to bring this here too, and all we got was support, and that was fantastic, and we appreciate it. So we did what we needed to do to try to write up a strategy, and it was blessed by our leaders, and then my fine coworkers stepped up to volunteer, and I think it was more people that volunteered than I thought would. It's not the driving fast and lights and siren and the exciting stuff. It's a challenge. So
I know Officer Wilson is the only one that's been through the CIT training yet. I was hoping maybe Captain Roman, if you could just give us an overview of what that training looks like. I know that you and Sarah both coordinate that training.
Sure. I'll give you just sort of the nuts and bolts, and Sue can certainly chime in as well. She's well versed on the CIT training too. Typically, the CIT training involves a kind of a partnership between a law enforcement agency and, if there's a NAMI within their range or area, to kind of partner with NAMI to put together a 40-hour training. There are some components to the training that you'll see in most CIT trainings wherever you go in the country, but they are really kind of designed to be tailored to the individual agencies or communities based on the resources that are available to them in that state or in that county or in that city. So, but the 40-hour training, some of the fundamental pieces of that do include education about mental illnesses, sort of an overview of what the major mental illnesses are, what they look like, and then to take that a step further, one of the hallmarks of this type of training is that it puts officers in direct contact with consumers, with people who are living with the various mental illnesses, and also sort of their support systems, families, friends, and that sort of thing. So there's usually a consumer piece built into the 40-hour training. And then the other, I think, real fundamental piece involves curriculum that covers de-escalation techniques and how to apply those to people with mental illnesses and some of the unique challenges to that, because we all get training, as we know, in how to de-escalate situations. But how we dovetail that with mental illness has its own unique sorts of challenges, and then the opportunity to do some scenario-based training as a part of that 40-hour block. So there's other topics that get covered throughout the 40 hours, and again, those can change depending. Sue, I don't know if you wanted to add some of what those other pieces might look like. They do vary.
They do. There was one piece that I remember, and it's presented by a former police officer on taking care of yourself as far as mental illness goes, and he speaks from experience with a suicide attempt. So I think that was, a vital piece. But the other thing I think that is important is that during the training, we have the chance for each trainee to visit someone that has a mental illness that isn't in crisis. So you get to talk to people when they're at their best, so to speak, and rather than at their worst, as you would at a service call, perhaps.
So just so you know, I know that we will be offering another CIT in June, and then we're looking at another one yet potentially in December as well. We've sort of blocked off the time already for that in December too. So.
Thank you.
Maybe Sarah, you want to say a little bit about your piece and about what you do as your liaison with us?
Sure. So for me, this has been really exciting to see some of these other departments start to take a more active role in doing this mental health liaison work, as Madison has been doing for several years, because I've seen the impact of that and how effective it can be in improving police relationships with community members who struggle with mental health issues, so that we have more knowledgeable officers who are better connected to people in the community and therefore better able to reach desirable outcomes in these service calls, and as well as doing the proactive work that the goal of which is to reduce the amount of calls for services by reducing the amount of crises that occur, by connecting people to services, making sure that they have the things that they need. So as Brenda said, I've been attending these meetings with the other departments. I try to be as available as possible to, and not just these departments who are putting an active effort into rolling out this type of program, but any police department. I have contacts on all of the departments in Dane County, so that they have a point person that they can talk to at Charney about their interactions with crisis and responding to mental health issues in the community and doing emergency detentions and the other things that represent where we intersect. And also so that I can reach out to them when there is new information, like some change in how maybe a change in the Chapter 51 law, or a change in or an update or new information that they need regarding these processes. So I think, in my experience, the more actively that we can collaborate, talk about issues before they become huge crises, or even talk about situations afterwards and kind of identify what worked and what didn't and what we want to apply to next time, I think it just makes all of our work a lot more effective.
One of the other collaboration efforts that Madison has invited us to attend their monthly training, what do you call them, Kristen?
We have, we bring all of our volunteer liaison officers together monthly, and now, we also have added the 5 full-time officers. So that's a time where we bring everybody together, as many can make it, and we usually, get people coming in on their days off, and are compensated, to come in and do that as well. And it's an opportunity for all of them to come together, and typically we'll try to coordinate some sort of a training component to that. We'll have somebody from the community, a service provider or a group home, or we're gonna have NAMI come in, actually, that's on the docket. So we try to build in outside partnerships, presence at those meetings to educate the officers, answer questions that they might have about things that have come up, and to, to kind of add to that. And then Sarah is at those meetings monthly, and it's an opportunity for the officers to have some real direct contact with her, and vice versa. And then lastly, they talk with each other to try to share experiences, things that went well, things that they're looking to help, with help problem solving. Individuals that clearly, while we break up into districts and areas, people are mobile, and so it's an opportunity for them to share information about individual cases as well. And so we found on our last meeting, you weren't at the last meeting, but it was pretty well attended. We had UW and Verona and Fitchburg and Middleton there, in addition to our group. And we actually did end up having some sort of connection take place there, where somebody who lives in Middleton but works in Madison. And so we found the benefit of having that coordination. So it's a standing meeting, and you all are invited to attend anytime. We'd like to try to get a head count so we know how much space we're going to need, because we have about 20 of our own folks, plus if we have partners coming in. And now with the mental health full-time, there's 25 plus anybody else. So, but it's a good chance, and you're welcome to call anytime you are able to do that. It's exciting for us to be able to coordinate, because we all know that we are running into many of the same people.
So we've already had